Hey, Doctor, good morning.
Hello.
Hey, good morning, Doctor. How you doing? Thank you so much for joining us on the show today. So we have Dr. Gotabhaya Ranasinghe from the National Hospital of Sri Lanka. And I know you must be really busy, but thank you for taking the time.
Yeah, thank you for having me.
Doctor, so we're going to talk about the COVID-19, and we have a few questions we want to ask you.
Mm-hmm. We want to start and kind of enlighten everybody that's listening in about the nature of what exactly we're dealing with. Now, if the GMOA's figure, I'm just going to dive right into it. The GMOA has predicted a figure of at least 550 unidentified COVID-19 cases, and they're saying that this could be a reality. Do you think that in the current situation, someone like you would know best, will Sri Lanka be able to handle that influx of new cases? I mean, day by day, we're seeing more and more pop up. What do you think?
I believe if we reach that number, 500 odd number,
yeah.
I think we have the infrastructure to handle at the moment.
Right.
And but I think I would say that is a threshold we are going to have at the maximum threshold. Beyond that, if you get the number beyond that, I think we would find it very difficult, because especially with the ICU beds and the ventilators, and then we would find it difficult. But I think up to about 500, 600, I'm sure we would be able to handle.
Right.
And so, yes.
That's wonderful. That's kind of what we needed to hear. That's good news indeed. Now, being the fact that you are a cardiologist, as far as the disease is concerned, the virus, how does that affect the human heart? I mean, we know the kind of effect that it has on the lungs, the respiratory system. But in terms of the heart, does it have anything specific?
Yeah. Actually, it's various theories in the world, actually, especially in South Korea, China, and Italy. If you see various theories, and heart 20, at least 10 to 20% of corona-infected patients, I mean, you get heart manifestations.
Yeah.
And these heart manifestations, actually in Sri Lanka, if you see, I just spoke to these guys who are handling it directly, and we haven't seen very many, I haven't seen actually single cardiac manifestation in Sri Lanka up to now.
Right.
But fortunately, we are lucky, Blessie, because we don't see very many cardiac manifestations. Patients they just come with the respiratory symptoms. But but in World Series, if you talk about cardiac manifestation, they can just come with a heart attack. And just a major heart attack or minor heart attack, or can be just chest pain mimicking a heart attack. People get confused whether it's a heart attack or not, but just chest pain. It's not a heart attack, but tightening chest pain, just like a heart attack.
Right.
And also they can come with heart failure, Lloyd, because they can come with severe breathing difficulty and the kind of all the symptoms of heart failure.
Right.
And also remember that various rhythm abnormalities. They can have very fast heart rate, very slow heart rate. Or they can have just a sudden death. You know, when heart is affected, you can have a sudden death. And so I don't know whether you have heard there had been anecdotes, and they just got chest pain, fever, and just died. And then this could be just a sudden death. That's because the heart is very likely that heart is affected.
Right.
So it is a kind of a spectrum of manifestation when it comes to corona infection and the heart.
Right. So these are all the things that can happen when you have a COVID-19 infection. Now, doctor, that is quite scary, the fact that your heart could just stop, a sudden death when you have the COVID-19. So people are showing a whole range of symptoms from what you're saying. Also, doctor, is it possible to carry the COVID-19 virus and not display any symptoms? So I know there are a few mild cases, but even in the mild cases, are there possibly people walking around us that look normal that might have the COVID-19?
Yes, Lloyd. That's the most dangerous part of this whole game, because it's like there are some theory there are about 20% of patients who carry the virus, coronavirus, but they don't show any symptoms. They are the most dangerous people because they spread the virus.
Right.
And so this is the most dangerous part of the whole game, because we don't know whether they carry the virus or not. So up to about 20% in World Series, but in Sri Lanka, I don't think we know that number yet. And so they could spread to others. and they don't have any symptoms.
Which is the scary part.
So
Exactly.
Speaking of tests, do you feel that we have enough tests to be able to do more testing? Because seemingly that is the one most important thing that could help have a better picture of what we're dealing with.
Bessie, I don't think at the moment we have we are very equipped with testing, because we are trying. I think government is trying their best. I think government is very well geared and we have very good leadership, and we have a very efficient task force, and the military is involved, and so all that. I am sure we would get these kits for testing very soon, because they are looking at it now at the moment, and testing is the key. Testing is the key.
Right.
Yes.
And Doctor, now getting back to some of the questions about the COVID-19, something else that we were talking about is that now, if you look at some of the deaths that have happened, they've included, young people or healthy people that have been fit. There've also been, I think, a large number of more elderly patients. There's been people that have, that we've lost, that have suffered from other illnesses. Is there any pattern to the people that are the most affected by the COVID-19, Doctor?
Yes, I think it's all depend on the country and ethnic group and demographies and various things. But in Sri Lanka, I think I would say the most of the affected people are actually young adults, and they are like between 30s and 40s and 50s, and so we I don't think we have got very many elderly people. Right. And so I don't know why, because most of our elderly people, they are at home, so they don't move around, so they haven't got the infection. And mostly the young adults, between 30s and 40s, they are the ones like moving around, they contract the infection. That may be one reason. Also, most of the fatalities we had in Sri Lanka, they had other comorbid conditions like diabetes, heart failure, kidney failure, and high blood pressure. So I think these people are more vulnerable. And their mortality is like very, very high. It's about 50% mortality if they are affected.
Right.
Yeah, absolutely.
Makes sense.
And speaking of which, how deadly is the COVID-19 virus compared to something that people are comparing it to in the States, influenza, or even dengue, something that we've been battling locally?
Yeah, that's a very good question, Blessie, because when it comes to, I think, corona infection, COVID-19 infection, and mortality is, according to various series, I think it's about 1%, 1 to 2%. But remember that if somebody is having cardiac conditions, as I told you before, other comorbid conditions, it could go up. It could go up even up to about 20-30%.
With other complications.
And, yes, with complications. But pure and like the very healthy individual, if they don't smoke, if they don't have comorbid conditions, and of course, like the complete recovery. So most of them, they recover.
Right.
And the mortality is about, I think, 1 to 2%.
Right.
And but on the other hand, dengue, now this is, corona is a respiratory infection, and it's a kind of it's a transmission to, I think, contact as well as the inhalation.
Yes.
But the dengue is transmitted through a vector. And so one would not expect rapid transmission.
Because you need to be bitten by the insect to get it, and Yes, that particular mosquito has to go and bite a person. That human-to-human transmission happens through the mosquito. Spread is not that fast, you know what I mean? It's not that fast. That makes so much more sense, Doctor, now that you've said that. So it's a completely different type of virus anyway, the way it's transmitted. And Doctor, now talking about these viruses, these infections, now the COVID-19, Doctor, is the latest one in a series. Now we've had SARS, MERS, we had Ebola, and all kinds of new viruses emerging. What are we doing wrong, Doctor? How come there's a sudden, I think over the last 20 years, there's been so many more of these. What exactly are we doing wrong? Is this something to do with the wet markets, what we're eating? If you could guess, or if you could point your finger at something, what would it be?
Of course. I mean, that Bill Gates in 2015, he predicted this.
Yeah.
And he predicted this kind of, he even mentioned the name, the virus, influenza virus, coronavirus, he predicted. I mean, this virus, we have been knowing, and when we were medical students 10, 15 years ago, and we were taught about this virus.
Right.
And we knew all that, yes. And, but the thing is, Lloyd, I mean, we took everything for granted because we know the world is focusing on the economic warfare, world is focusing on military warfare, and they don't think about, they are not prepared. They took everything for granted because they never thought that one day a virus, or rather bioterrorism, would hit the whole world.
Right.
Now today, whole world is recoiling with horror because of this coronavirus infection.
Yes.
And I think the main thing is like we underestimated the bioterrorism, or we underestimated the kind of the microbe attacking the whole world. So that kind of the phenomena we avoided, and we didn't take them very
seriously. Definitely.
It's quite interesting that you brought up bioterrorism because, as you know, there are several rumors which I guess haven't been proven yet, but perhaps there's a bit of truth to it. What are your thoughts on China's claim that the U.S. military brought the virus to China?
I
guess it's not a medical question.
We're stirring the pot here, doctor.
But you brought it up.
Yeah, because this is a very sensitive question. But anyway, if I use my common sense, if US did that, and how come that same virus got it to US back and then hit hard?
I think you've answered that question already. That's so true.
Yes,
right.
And if US did that, US would have taken every precaution and put the virus there in China.
Right.
And so, but unfortunately, poor US, now they also got it back, and they are hit at the moment hard. That's the epicenter at the moment. Yeah.
They're having a difficult time dealing with it. Now, Doctor, thank you so much for all the time. Now, before we let you go, just one last thing I want to ask you.
That's right.
As Sri Lanka, now we're aiming to eventually come out of lockdown, kind of resume our normal duties. Do you have any advice for the people that are coming out of lockdown and how they should operate, what protocol they should follow at work and in public environments?
I think what you have to do is we have to keep this, keep the lid on with all these measures. I would call we have to have the draconian measures, very strong measures, lockdown, isolation, social distancing. I think we have to keep that at least for another 2-3 weeks.
Yeah.
And every 2-3 weeks, I think we have to assess the situation and see whether where we are heading. And according to that, we could adjust our measures. And so that's why I think that is the most important thing. And also, Lloyd, we have to test. We have to test all the potential cases, all the high-risk cases.
Exactly.
And if they are positive, we have to isolate them. And if they are all the contacts, we have to quarantine. So that is a very, very, very important thing.
Right.
And also, people should stay in. And most important thing is, I think, maintain social distancing, physical distancing, and also wash hands. Wash hands. That's the most important thing. Wash hands. At least they say at least 5 times a day. 5 times a day at least, wash your hands.
Right.
And with soap or some sanitizer.
Right.
And also, wear the mask. It's very controversial, but my personal view is please wear your mask when you go out. There's no question about it. And everybody has to wear a mask if they are going out.
Yeah.
It prevents getting infection.
It's best to be safe.
In general. Yeah.
Right. Doctor, thank you so much. You have been an absolute treasure, and I value your time. Thank you for coming on the show, and thank you for
thank you very much for having me.
Hey, please be careful as you are out there, and please thank your co-workers over there for us, and on behalf of everybody that they've been serving.
Thank you.
You too, Blessie. Both of you all take care.